As many as 11 million Americans have some form of age-related macular degeneration. Dr. Timothy Murray is a retinal specialist and the president of the American Society of Retinal Specialists. Good morning and welcome to the show.
Good morning. Thanks for having me with you.
Important topic to discuss. So can you give us the symptoms of macular degeneration?
So the biggest thing to realize with macular degeneration is that it affects the central vision, and it typically affects one eye at a time. So you have to examine each eye independently by covering the other eye. And what you're looking for is the sharpness of your central vision. You don't want to have distortion or blurriness or waviness of the lines, and you want to compare each eye together. If one eye is significantly different or you have that blurring or distortion, that is an emergency for you to be seen by a retina specialist.
Are these kinds of things not found in a regular routine eye exam?
So it's important with your eye exam that you have what we call a dilated retina exam, and that's where the pupil is dilated with drops to open it up to let us see more directly and more precisely the retina. In a retina specialist office, that's coupled with really advanced imaging, where we can look at the layers of the retina almost microscopically, and that's rarely available outside of a retina specialist office.
Well, what are the causes or the leading causes for macular degeneration?
So the biggest component of macular degeneration is aging. So as we as a population are living longer, which is wonderful, we have more time to have degenerative disease of the macula, and that's how age-related macular degeneration occurs. It clearly has a genetic component, and it also is familial, which means if someone in your family has age-related macular degeneration, you have a significant risk of having that also, and you should be seen by a retina specialist.
And so what is the name of your new campaign?
So we're doing a campaign that is See for a Lifetime, See a Retina Specialist. Many of my patients had no idea what a retina specialist was until they had such a serious problem that they had to be seen. We'd like our patients and our future patients and our families to know what a retina specialist is, what are the conditions they should be seen for, and that there is a retina specialist close to them almost anywhere in the United States.
And where is the website that our viewers can go to learn more about the campaign and about macular degeneration?
So you can go to the website at seeforalifetime.org, seeforalifetime.org, and it has information in English and in Spanish, much more defined about the diseases, the imaging and diagnostic treatments, and then the ability to use treatments now to prevent blindness that weren't even available 10 years ago.
And that's like exciting news that there are treatments.
Yes, ma'am.
Doctor, thank you so much for being with us.
Thank you for having me today.